Well, I am showing you a case of 70 years old female. She had hysterectomy performed a few months back, and now this is the left kidney of this patient, which measures approximately 8.6 centimeter in length and 3.37 centimeter in anterior-posterior diameter. Well, if this is the upper pole, this is the lower pole, this is the mid region. Central sinus echo complex is almost muffled, and however, this is the pyramid, and this is the cortex. This is the cortex measuring 5.6, and if I include the cortex and the pyramid together, it gives the parenchymal thickness, which is 11.3, is within normal. So these parameters are within normal. What else is seen is that the echogenicity of the cortex is raised throughout, and there is minimal hydronephrosis. These are not to be confused with cysts, because you don't see any posterior wall enhancement, and they are not that rounded, and this area should not be regarded as a calyx, dilated calyx. This is a pyramid, and this is the arcuate artery anterior to it. So the central area here, where we should have seen the central sinus echo complex, though a bit of fat is seen. This is the central sinus complex fat, this white area. However, lower pole calyx, mid region, and lower pole are minimally dilated. So the echogenicity of the cortex is though raised, and but the corticomedullary differentiation is intact. Therefore, a sign, sonographic sign of that the kidney is functioning properly. Another thing to notice that you see this is all fluid in the posterior, raising the posterior capsule between the cortex, posterior cortex in longitudinal, this one, and the capsule of the left kidney. We see fluid collection. This is all fluid. This area is all fluid, and there are septas within it, suggesting that it is in the process of being. These are all thread-like echogenic linear areas are all thick. This is thick one. This is thin. This is an indication of this area of this fluid collection. Loculated fluid is in the process of being infected. So 12.6 is the length, whereas because of the variation, this is all fluid. Now let me show you in real time what I am seeing. See, this is the anterior margin. This is the upper pole of the left kidney. Now you see this is the fluid between the cortex. This is the cortex of the left kidney, and this is the capsule, and between it we can see loculated fluid with echoes within it as well. Now moving towards the other part, now you see here you are seeing more clearly the pyramids. This is the pyramid, this is the pyramid, this is the pyramid, this is the cortex, and well, there is, again you see the fluid collection. You can see along with septations throughout the fluid, suggesting thereby that the area is in danger of being infected. These are all septas within the fluid, which is seen posterior to the cortex of the kidney and the capsule of the left kidney, with septas within the loculated fluid in this region. This is the lower pole of the left kidney, and you can see fluid all over. Well, another thing to note is that this is the pelvis of the kidney, and here we will see that, this is the pelvis of the kidney. This area, it contains echoes, and then this is the proximal ureter. Now what has happened is that this ureter has been either cut off or strictured or sutured on the left side during hysterectomy. So you can see that this is the pelvis, dilated pelvis, and this is the proximal ureter. This is not dilated, though measures 4.6 up to 7 is normal. And so far as the you can see that the kidney is being perfused normally and at all regions. So the function of the kidney is to preserve the residue. Now let's see the right kidney for comparison. Now you see this is the right kidney, and you can see the that it also shows this is the proximal ureter, as now these are the calyces. There is dilation of the calyces at all regions. Here you see dilated calyx, whereby the kidney is being perfused normally, is functioning normally. So bilateral trauma to the kidney during hysterectomy. So otherwise the kidney function is normal, perfused normally. This is our case of the day. Thank you very much.